Hello, my name is Nawal Nour, and I'm the chair of the Obstetrics and Gynecology Department. I'm also the former Chief Diversity and Inclusion Officer for trainees, faculty, and students at Brigham and Women's Hospital. It's a real pleasure to be here with you, and I look forward to sharing my perspectives of COVID-19 from a race and gender perspective. It is an honor and a privilege to be a part of this important event and to share the reflections of my 26 years of experience here at Brigham and Women's Hospital, and before that, as a Harvard medical student. I'm a practicing OBGYN where I led the division of ambulatory obstetrics practice. About 100% of our patients are underserved, and most of them speak English as a second language. In the hallways, you will hear Spanish, Haitian Creole, Somali, Arabic, and Amharic. I'm also the director of the African Women's Health Center. The overall mission of the African Women's Health Center is to holistically improve the health for refugees and immigrant women who've undergone female genital cutting. It provides access and understanding and community to women who have long-term complications from this tradition and who seek reproductive health care. What we do and how we practice medicine is that we put the patient at the center and address the full range of physical, emotional, mental, racial, linguistic, and social influences that affect women's health. Dr. Betancourt did an outstanding job of delineating the two seminal events that occurred this summer. COVID-19 disproportionately, as he mentioned, impacted communities of color nationally due to the densely populated housing and transportation issues. And as a result, we saw a higher mortality rate. The second event was the murder of George Floyd that created a national reckoning on racism. What I also want to ensure is that you all are aware of the women who also were murdered. That included Breonna Taylor, Tatiana Jefferson, Pamela Turner, Tanisha Anderson, Dominique Clayton, Sandra Bland, Michelle Shirley. Dr. Betancourt mentioned that structural racism is deeply embedded in healthcare, and that is true. We feel it, we experience it every single day. There are indeed disparities in health, access, and healthcare. It persists. Black women are 3 to 4 times more likely to experience pregnancy-related death than white women. They're more likely to experience preventable maternal death compared to white women. And these risks are high despite education and socioeconomic status. So we need to turn our lessons into actions. And one of the things that we have been doing at Brigham and Women's Hospital is advocating for our patients. So as COVID hit, as an institution, we needed to create policies. But some of those policies really didn't take an equity lens and to truly understand what our patients were suffering from. So for example, we created a no visitor policy, which made sense given the fact that COVID was so highly contagious and we were coping with our bed crunch and ICU issues. However, for example, for a pregnant woman who may have kids at home, if we encouraged her to come to her health visit with us and needed some testing because she happened to be a diabetic or had hypertension and needed to come to the hospital to have her care, and we needed to listen to the baby's heart rate, the issue was, what was she going to do with the children? And we indeed had a case where a patient did come and wasn't allowed to come upstairs because she brought her daughter with her. Now, she had exposed herself to the transportation risk and really was a very compliant patient, but because of our policies, she was turned away. We had to, as we heard about it, run outside and actually check her blood pressure and do her healthcare outside the hospital because she had finally made it to the hospital, but our no visitor policy stood. And so because of those types of things, and we were recognizing as these policies were coming out with the little gender lens and little equity lens to it, that we need to take proactive steps towards creating and protecting equity during the event of the public health crisis. We continued with our culturally and linguistically appropriate communication for all of our patients. And then we also recognized that we needed to provide childcare services during the appointments. And working alongside our community health workers, we were able to establish that. Joe Betancourt mentioned that we need to care for those within our walls and that communication is key. I can't agree more that in fact we need to take care of our employees as well as our patients. One of the things we recognized early on was that there was plenty of xenophobia that was occurring, and that our patients as well as our providers were suffering from discriminatory comments that were really hurtful and hateful. And because of that, we were created a town hall where we supported our community in the time of COVID and enabled very healthy and helpful conversation for our employees and trainees as well. In the meantime, we also recognized that as some were required to work from home, that you had mothers who were balancing being a full-time employee as well as taking care of their kids who were either too young or were told to stay, whose kids were schools had closed. And so they were juggling being a full-time employee with childcare. At that point, we were able to create a hashtag #HeForShe, where we were recruiting men to really encourage the fight for gender equity and inclusion in academic medicine. And we recognized very soon thereafter that many women were either highly burnt out, and according to a National Women's Law Center, many women in our workforce are actually leaving. So we've created a lot of effort to support our faculty with dependent childcare gaps, and created also safe spaces for our trainees and students to be able to discuss the racism and health inequities that they were experiencing and seeing. And so I'd just like to introduce you to our Center for Diversity and Inclusion, and you'll find that on the top right-hand side is Dr. Galen Henderson, who is now the Chief Diversity and Inclusion Officer. And the center is to promote a vibrant, diverse, and inclusive professional community where every person thrives, and making this effort to ensure that everybody is welcome in our institution and that we are taking care of each other as well as we take care of our patients. And so COVID-19 inequity continues to be an issue. We're just getting ready for the next surge. But in the summer of 2020, we created an equity advisory committee that involved leadership in incident command and recovery, as well as our chief medical officer and hospital leadership that worked in the community outreach, HR, and the DE&I world, to come together to start thinking through some of these processes as we were bracing again for the next surge. And what we have recognized is that disparities are common, and we are committed to reducing them. We are going to stratify performance data by race, ethnicity, and language, and provide disparities trainings for providers and staff. We also want to make equity an integral component of quality improvement and patient safety efforts, and recognize that equity across every dimension of quality, and ensure that disparity reduction efforts are central to the process of quality improvement and patient safety. And so I'd just like to end that it has been an honor and a privilege to be working alongside Joe Betancourt and others in the MGB area. We have created a United Against Racism, and we know that the work continues, and we must strive to help all of us and our community and our patients. Thank you.